So we're here with Dr. Ralph Poppenbeek, occupational physician from Victoria. Ralph, you're often asked questions around liability, and you've done many of these over the last decade. So I'm wondering whether there's any questions that you would recommend to a case manager that are more effective in helping you to explain issues around liability.
It's an interesting question from my point of view, because what we're often talking about is the difference between causation and association. Things can occur simultaneously and they're associated, but that doesn't mean that one causes the other. For instance, all cars in car crashes have rubber tires, but that doesn't mean that rubber tires cause crashes. So we have this situation when we're talking about causation of a person having an injury or an illness in the workplace or the workplace area. And then the fundamental issue is there a material contribution from employment to that injury or condition. Now that involves taking a very detailed history both of the person's occupation and of the circumstances regarding the onset of their symptoms. And then you can make a judgment call. But it is a fairly rubbery sort of judgment in the sense that we're not talking about numbers as we would be if we were doing a statistical analysis. So what we're talking about is our best assessment of a balance of probabilities evaluation. Now, I'm talking here only as a doctor and someone who's done some research, and so I'm familiar with statistics. A lawyer may have a completely different view on all this. So I think the standard concept is whether there's significant work contribution, and that's in the end a judgment call. But you've got to express your reasons for doing so. And it may be useful to ask that in the question. Can you also state the reasons why you're making this assertion? Because I find sometimes supplementary reports concern themselves with what was the reasoning behind your making that assessment.
Yeah, I think that's a good point, and certainly the old adage is that whatever your opinion comes to, as long as it can be justified, as long as you can support that argument, where the reasons why you've come to that conclusion. I think you also mentioned that, you know, generally the questions that you're asked from case managers and other referrers are very strong and enable you to make comment on all the important things. Is there any question over the time that you've been doing medico-legal assessments that you have felt, oh, I wish that I would be asked this question? I think it'd be a really valuable question to include as standard in any referral documentation that is provided to you.
Yeah, that's very easy to answer. Most of the questions follow a fairly specific format, and that's good. I may be a bit simple, but I don't have any trouble with that. But the question that would be really useful to ask is asking the doctor, is there anything further you would like to add to this assessment? That enables a lot of the criticisms people come up with from the question list to be answered, because you can then state what you think. I sometimes find that I'll see a person and from my perspective, the treatment has been a total disaster, and that's the reason why I'm seeing them. But I'm asked about work capacity, liability, diagnosis, not about treatment. If that question were included, is there anything else you'd like to add? I would certainly talk about the treatment.
For sure. Okay, fabulous. Thank you for that. Thanks for sharing your wisdom with us.
Thank you.